welcome to The Explainer. Today, we're diving into E. coli. We're going to talk about the signals your body sends, the stuff you absolutely need to pay attention to. By the end, you'll know exactly what's just a stomach bug and what's a sign you need to act and act fast.
So, here's what we've got lined up. First, we'll hit the classic digestive symptoms. Then, we'll see how this thing can go body-wide. We'll also cover a really serious complication called HUS. Talk about why it's different for kids, and wrap it all up with the big one. When is it time to call a doctor?
All right, let's get right into it. Section 1. Digestive distress signals. This is all about the signs that show up right where the trouble usually begins, in your gut.
You know that feeling, that sudden, awful stomach cramp. Is it just something you ate, or is your body trying to tell you something more serious? Look, we've all had a stomach bug, right? It's so easy to just say, I'll power through it. But with E. coli, some of those symptoms are actually urgent messages. Learning to read them is key.
Okay, so you're really looking for a classic trio of symptoms here. First up, abdominal pain. And we're not talking about a little ache. This is often sharp, severe cramping that just won't quit. Then you've got nausea and vomiting, which, as you know, is a fast track to dehydration. And finally, diarrhea. Now this is a big one. It might start off just watery, but a huge red flag for the more dangerous E. coli strains is when it becomes bloody. That's a sign that the toxins from the bacteria are literally damaging your intestinal lining.
All right, so that's what happens in the gut. But this infection doesn't always, stay put. Let's move on and talk about what happens when the symptoms go body-wide.
Think of it like this. Your immune system has declared war on an invader. And that battle, it's not just happening in one place. Your whole body gets the memo. It starts diverting all its energy and resources to fight off the bacteria, and you are going to feel the effects of that all over.
So what does that feel like? Well, two big things, fatigue and fever. The fatigue can be absolutely draining. I mean, you feel wiped out because your body is working so hard. You'll also likely get a fever, but it's usually on the lower side, typically under 101. It's just a clear signal that your body's defense systems are in full swing.
Okay, now here's where things get kind of interesting. The exact same E. coli that's causing all that digestive chaos, it's also the #1 cause of urinary tract infections, or UTIs. The bacteria can actually migrate from the gut over to the urinary tract, and well, that starts a whole different kind of party you don't want to be at.
And if that happens, you'll start seeing all the classic signs of a UTI. You know, that burning or pain when you pee, feeling like you have to go all the time, maybe your urine looks cloudy or just smells off. It's worth pointing out that, yeah, anyone can get an E. coli-based UTI, but the source material makes it clear that women are at a higher risk here.
All right, we need to shift gears for a minute and talk about something really serious. Look, most E. coli infections, they go away on their own. But there's this rare but critical complication called Hemolytic Uremic Syndrome, or HUS for short. And this is something you absolutely need to know about.
So what exactly is HUS? Well, think of it this way. Certain nasty strains of E. coli pump out these powerful toxins. If those toxins get into your bloodstream, they start attacking and basically shredding your red blood cells. Then, all those damaged cells clump together and form these tiny clots. And those clots, they clog up the super delicate filters in your kidneys, which can lead to kidney failure. It's a really dangerous turn of events, and it typically shows up about a week after those first stomach symptoms started.
So the signs of HUS, they are a huge escalation. We're talking about more than just feeling tired. This is extreme fatigue, a really noticeable paleness, like the pink color is just gone from inside the eyelids or the cheeks, and a big one, you're not peeing as much. These are not wait-and-see symptoms. They are urgent, screaming signs that the infection has taken a dangerous turn and is messing with the kidneys.
Okay, let's focus specifically on kids now, because this is so important. Anyone can get E. coli for sure, but children, especially kids under 5, they're in a much more vulnerable spot. Their immune systems just aren't fully built up yet, and that puts them at a much higher risk for developing that serious HUS complication we just talked about. Now, the symptoms you'll see in kids are pretty similar to adults, but the scary part is things can get worse and get worse much faster. Bloody diarrhea is common. If they're vomiting and just can't keep anything down, dehydration is a huge immediate worry. For any parents listening, a really critical sign to watch for is decreased urination. I mean, if you're noticing fewer wet diapers, that is a major red flag.
And if HUS does start to develop in a child, the signs they're alarming. The kid might be incredibly tired and just super irritable. They might look really pale.
You might even see some swelling in their legs, ankles, or feet. Again, these are absolutely not symptoms you wait on. This is go time.
Okay, so this brings us to what might be the single most important part of this whole explainer. Let's talk about the non-negotiables. The signs that mean you stop waiting, you stop wondering, and you call a doctor.
So here's some good news first. Most of the time, your body is a champ. It can fight this thing off on its own in about 5 to 10 days. But, and this is a big but, there are some very clear red flags that tell you this isn't a normal case and you need to get a professional involved.
Rule number 1, the 3-day rule. If the diarrhea has been going on for more than 3 days straight, that's your cue, it's time to get it checked out. By that point, your body should be turning the corner, and if it's not, you might need backup.
Rule number 2, the temperature. Remember we said the fever is usually kind of low? Well, if that number on the thermometer hits 102 degrees or goes even higher, that's a whole different ballgame. That's a signal the infection is more serious and you need a doctor's opinion.
And here are the other absolutely critical warning signs. Any blood in your stool or your urine, that's an immediate call. No hesitation. If you're vomiting so much you can't keep any fluids down and you're getting dehydrated, make the call. And if you see any of those HUS signs we talked about, that extreme paleness, not peeing much, those are your body's loudest, most urgent alarm bells. You have to listen to them.
Okay, let's just nail this down one more time. The key takeaways. Most of the time, this infection will pass in about 5 to 10 days. But you now know the critical red flags that mean you need to take action. Diarrhea for more than 3 days, a fever that hits 102, or any blood in your urine or stool. Remembering just those 3 things could honestly make all the difference.
Look, at the end of the day, this isn't about being paranoid about every little stomachache. It's about being prepared. Your body is always sending you signals, it's always communicating. The only question left is, are you listening?